Aseptic preparations and preventing surgical site infections. Victoria K. Harriet, Georgia Southwestern University. Effective Teaching and Learning Strategies, Nurse 6220, Teaching Project, April 15, 2016. Materials needed for the activities in this presentation include samples of each aseptic preparation kit, one for every 2 people, a laminated palette with different skin tones, a human-like mannequin for practice, and there will also be a post-test included at the end of this presentation. By the end of this presentation, nurses will be able to demonstrate proper prepping technique with each prep solution discussed within the slideshow. All nurses will indicate the accurate amount of time necessary to allow prep solutions to dry. Each nurse will verbalize ways to ensure that surgeons abide by prep drying time by providing examples of ways to effectively utilize time. Nurses will score an 85% or higher on the post-test provided. Participants will acknowledge a better understanding of the different aseptic preparations and their importance in preventing surgical site infections. And occurrence of surgical site infections, or SSIs, will decrease by 25% in the next quarterly quality audit. Let's begin by first discussing surgical site infections. Surgical site infections, or SSIs, are the most common of all healthcare-associated infections in the surgical population. The integumentary system is the largest organ of the body. The microbial composition of our skin flora provides us with a protective barrier against daily contact with infectious microbes. However, a large number of these protective microorganisms on the skin can cause a surgical site infection. Therefore, it is crucial that the perioperative nurse understands the importance of proper aseptic technique. According to Zinn et al., skin preparation decreases the risk of SSIs by removing biodiridin, such as soil and transient microorganisms, from the patient's skin, decreasing resident microorganism counts quickly while not irritating tissue, and also preventing regrowth and rebound of microorganisms. Let's begin by first discussing. Our facility has approved 4 types of skin aseptic preparations. These include DuraPrep, ChloroPrep, Betadine scrub in solution, and Hibiclin. Alcohol, in the past and even now, is considered a great aseptic solution. It immediately kills germs that it comes in contact with. However, alcohol evaporates quickly, causing it to have no residual effect. Also, among these 4 approved skin aseptic preparations, there has not been any evidence to prove that either of them is superior to the other. Our prep discussion begins with DuraPrep. DuraPrep is iodine-based with alcohol. Alcohol's aseptic principles used in combination with iodine's residual effects makes for a great form of asepsis in the surgical field. DuraPrep should not be used on patients with an iodine allergy. Also, any patient stating that they are allergic to shellfish should also avoid using DuraPrep because the patient could have an allergic reaction to the iodine within the DuraPrep. DuraPrep is a paint, not a scrub. Therefore, when applying DuraPrep to an incision site, start at the incision site and move outward in a circular or square motion away from the site, making sure not to paint over the same spot twice. Cover the entire surgical field. Now everyone, grab a partner and take a few minutes to demonstrate how to accurately apply DuraPrep on a patient's skin using the laminated skin palettes and the prep sticks provided. Once each of you has had a chance to exhibit proper technique, continue to the next slide. Your instructor will guide this activity. Our next prep up for discussion is chlorhexidine gluconate, or CHG. CHG comes in many forms, one of which is called chlorprep. Chlorprep is chlorhexidine gluconate and alcohol. Research has shown that chlorhexidine products have a low incidence of irritation and maintain their antimicrobial efficiency in the presence of blood, unlike iodine-based products. To apply chlorprep, you must first scrub the incision site for 30 seconds, then continue to scrub in a checkerboard motion, going up and down and left to right until you've covered the entire surgical area. Chlorhexidine gluconate also comes in the form of a solution, or it comes in the form of cloths. Part of the preoperative process requires patients to bathe or shower 2 times before surgery with a 4% CHG solution or the 2% CHG cloths to begin the process of asepsis. Our next prep up for discussion is now everyone grab your same partner and take a few more minutes to demonstrate how to accurately apply chlorprep on a patient's skin by using the laminated skin tone palettes provided as well as the prep sticks. Once everyone has had a chance to exhibit proper technique, continue to the next slide. Your instructor will guide this activity. Veriprep and chloroprep are both alcohol-based aseptic preparations. According to the product instructions, these solutions must be allotted a minimum of 3 minutes to dry, as to allow for proper binding of the aseptic chemicals to the skin, as well as to decrease the fire hazard risk related to the alcohol components. Everyone in the room is responsible for patient safety and should adhere by the 3-minute rule. The nurse can allow the surgeon this time to go scrub at the scrub sink while waiting for the prep to dry. The surgical tech can withhold drapes and towels until the 3 minutes is over. The nurse or the anesthesia can set a 3-minute timer so that everyone in the room is aware of when the 3 minutes is over. The nurse can also do a timeout during this time to make time pass. Also, during these 3 minutes, the people in the room can discuss materials needed for this case as well as any other cases to follow. Our last prep up for discussion is povidone iodine betadine scrub solution, also called a wet prep. Betadine solution and scrub works by free iodine binding with bacteria on the skin. In order for this prep solution to work, you must first remove organic substances such as blood, pus, or fat from the site before using betadine. To apply a betadine wet prep, first you open the prep kit and don sterile gloves that are provided within the kit, or you can use whichever sterile gloves you prefer. First, pour the bottle labeled scrub onto the scrub sponges, and the bottle labeled solution onto the sponge sticks. Use the 6 scrub sponges to first clean the site, scrubbing from the incision site and outward. Pat the site dry by using the provided sheets within the kit. Then continue by painting the site with the 3 sponge sticks. Allow the prep to dry for 3 minutes so the iodine has time to bind to the resident bacteria on the skin. Now everyone partner up and take a few minutes to demonstrate how to accurately apply a wet prep on a patient's skin using the mannequins provided and the prep kit. Once everyone has had a chance to exhibit proper technique, continue to the next slide. Your instructor will guide this activity. Hemiclins, as discussed before in an earlier slide, is a form of chlorhexidine gluconate, or CHG. It was the first surgical hand scrub provided as safe and effective by the Topical Antimicrobials Committee of the FDA. It is used as an alternative wet surgical aseptic preparation if a patient is allergic to betadine and they have an open wound. Sometimes this prep can also be used by diluting it with sterile water. Application of Hibiclins is similar to that of the povidone iodine scrub solution. This prep should also be allowed to dry for 3 minutes so the chlorhexidine gluconate molecules have time to destroy the cell membranes of gram-positive and gram-negative bacteria. Now, get with your partners again and demonstrate how to accurately apply a HIPAA-cleansed wet prep to a patient's skin using the mannequins and prep kits provided. Once everyone has had a chance to exhibit proper technique, continue to the next slide. Your instructor will guide this activity. Special considerations when choosing a prep solution. Always ask a patient their allergies before taking them to the surgical suite. Any allergies to betadine, iodine, topical or injection, or shellfish allergies should be a red flag for not using DuraPrep or betadine povidone iodine scrub solution. Also, hair removal is key. It is the most effective way of achieving surgical skin preparation. Hair is a significant reservoir for microbes and organic matter, and should it ever enter the surgical site, it will act as a foreign body. Also, when choosing a prep solution, it is important to consider what type of surgery the patient is having and whether there is breakage in the skin or not. Now we have come to the end of the presentation. Please continue by taking the post-test and answering the questions as the answers are provided. What is the proper technique to apply ChlorPrep? ChlorPrep should be applied by first scrubbing the incision site for 30 seconds. Then you must go in a checkerboard motion up and down and side to side until the entire surgical area has been covered. True or false? You should avoid using iodine-based prep solutions if a patient has an allergy to shrimp. If you answered true, then you would be correct. Shrimp is considered a shellfish. Any patient stating any allergies to shellfish should avoid contact with iodine-based prep solutions. What motion should you use to apply DuraPrep? DuraPrep should be applied in a circular or square-like motion, starting at the incision site and going outward, without painting the same site twice. True or false? You should not wait on DuraPrep or ChlorPrep to dry, because the alcohol will evaporate and the aseptic principles of the solution will be lost. If you answered false, then you would be correct. Because the alcohol is combined with the chlorhexidine or the iodine, gives it its residual effects. Also, by allowing the prep solution to dry, you decrease the risk of surgical fires. How long must you allow an aseptic prep solution to dry? All of the previously mentioned prep solutions must be allowed to dry for at least 3 minutes to allow the antimicrobial components to bind to the bacteria on the skin, as well as to allow any of them to dry to decrease fire hazards in the surgical suite. True or false? DuraPrep is the best FDA-approved aseptic preparation. If you answered false, then you would be correct. There has been no scientific evidence to support the fact that there is any superior aseptic surgical preparation. What are some ways to prevent the surgeon from making incisions before the required dry time has elapsed? The nurse can allow this time for the surgeon to scrub at the scrub sink. The nurse can ask the scrub tech to withhold drapes and towels until the 3 minutes is over. Someone in the room can set a timer to 3 minutes so that everyone in the room is aware of when the time is over. The nurse can also do the timeout during these 3 minutes. Also, the people in the room can discuss materials needed for the current case or upcoming cases. True or false? If a patient's hair dislodges into a surgical site, the body will treat it as a foreign object, which could increase risk for infection. If you answered true, then you would be correct. Hair is a significant reservoir for microbes and organic matter. If hair is near or around any surgical incision site, it should be removed with a facility-approved clipper before the aseptic preparation is applied.